This conference will now be recorded.
Welcome, guys and gals. Welcome to the Alliance for Massage Therapy Education's Sunday support sessions. We are so pleased that you are here. Today, we have an awesome topic for you, and it is about what is it going to be like to go back to school. What's it? Some of you guys are already open. Some states are already open. Some are on the cusp of opening. Some have a couple more weeks. But what is that going to look like to do so safely? So that's what our conversation is about today. And I will introduce our speakers in just a few minutes. But we've got a few things that Dr. Cowan wants to, Virginia, why don't you take it from here?
Okay, thank you so much, Jody. And hi, everybody. Thanks for spending your Sundays with us. We keep waffling about the name. It's a conversation. It's a support session. We're doing this series, and we have been doing it to really provide a space for exchange of ideas, provide support to teachers and schools, really focusing on what the Alliance does, which is support and advocate for massage education. As Jody mentioned, everybody's in a different place. We know that there are some states that are actually back in the classroom, some regions that are back in the classroom, and some folks are out of the classroom for the foreseeable future. Right now, this is like an essay exam. There's no one right answer. Everybody needs to really look at what your own personal guidelines, but really then also looking at what your institution, your accrediting bodies, your state boards, and then also professional standards. And so there's still a lot of anxiety online. We hope if you're the anxiety online people, you've found your way to us, and we can be here to support you. If you have ideas, if you have thoughts, we will be, we've had some requests to keep the second half of these sessions open for Q&A. It gets a little chaotic. We've had signups for these sessions for roughly 350 massage educator school owners. So it's exciting to get everybody into one place. We've had presentations from CompTIA, from FSMTA, from massage school owners and faculty, and then some of us from the board. I'm the board member of the board of directors currently. I'm the board liaison for teacher resource development. I've worked in higher ed for 20 years. Not all of that's been a massage, but it's all been in integrative health. So in looking at this, right now, what we're facing in reopening is some different needs. One need is safety for students, for faculty, safety practice, safety in the clinic. Another need is teaching and learning. And we'll hear some of that today, looking at considering hybrid, considering front-loading classes. When do you start new students? And how do you really integrate learning from didactic courses into the hands-on curriculum, which is what I think makes a lot of people nervous. And then also screening your students, requiring immunizations if we ever get to that and have a vaccine, which is a long way off. What happens if one of your students tests positive? So all of these are, again, there's no right answer, but then also from a learning perspective, if we come back to that and look at, will we need some remediation later on for students who are, currently not getting the full hands-on experience in school, or, are falling behind because of teaching and learning, challenges. So these are all things that we have been discussing and we hope to discuss going forward. So before we get to our presentation, I give you a commercial, and this is not a beautifully produced commercial, except to say that the Alliance is offering its first ever mentoring program. And this is a pilot program. We're going to be running it this summer because we realize a lot of folks have either things to offer or have needs. So you can apply for the mentoring program. Look for the link on the Alliance's website. I think it might be on the blog. But you can sign up to be a mentor, or you can sign up to be mentored, so you can be a mentee. And so if you're looking at revamping your active learning strategies, if you're looking at moving courses online and you'd like somebody to help you through that, if you want to develop competency-based rubrics, I've been talking about that with a lot of people. If you really feel like you could spend some time, 8 weeks over the summer working with somebody, it's all virtual mentoring. It's no cost. It does not cost to apply to be to be part of this program, but if you're accepted and you're not a member of the Alliance, you'll need to join, which is probably a whole lot cheaper than going out and hiring a mentor. So, please bear that in mind, and the application should be available. It's until midnight tonight Eastern time. So it's very simple, super short answers. Upload your CV, and we're going to do our best to match people based on topics, so that you have somebody out there to continue to support you, or you can offer support. So I'm going to turn it back over to Jody, and thanks much for your attention.
Yes, and thanks again, everyone, for being here. I'm really, really pleased to see you all. A couple pieces of housekeeping, and that'll be if you guys could go ahead and mute yourselves. That is a button that if you just move your cursor down to the bottom of your screen, you'll see a green button that has a microphone. Yours should probably be red, but if you could go ahead and mute yourself, that would be helpful. And then also want to make you aware of the chat box. There's a conversation balloon in the upper right-hand corner. If you're on a PC or on your phone, on an iPad, you just touch the chat, that little balloon cloud, and you can type right into the chat. And you can type questions, you can type comments, and I'll be monitoring that while our presentation is going on. So welcome to Sunday. Today is May 17th, 2020, and our presenter today is our presenters. We have two, and that is Michele Renee and also Spring Saldaña. Now, they are both from Northwestern Health Sciences University, a large university, which you're about to learn about, a little bit about. Michele Renee is a member of our of the Alliance board, and she's the vice president. She's been a massage therapist since 1998. She has been a chiropractor since 2008, and she has her master's in acupuncture, and that's since 2016. She began supervising and teaching massage at Northwestern Health Sciences University in 2008. She served as the program director from 2015 to 2019. She's currently the director of the Integrated Care program at Northwestern. Let's see, she completed her Integrated Care Leadership Certificate at Duke University and completed a Master's of Health Science in Applied Clinical Nutrition as well. Our second presenter is directly linked to Michele Renee, and that is Spring Saldaña. Spring is a licensed massage therapist for the last 16 years. She's a certified neuromuscular therapist also for 16 years. She's a Reiki master, so send her some good vibes, guys. She's been a Reiki master for 7 years, a massage educator for 12 years. She's been a massage program director or the chair for over 6 years, and has been with Northwestern Health Sciences since since September of 2019. And she was previously in Florida. She's a continuing ed provider. She provides trigger point classes. These are two very qualified women who are going to talk to us today about what the heck we need to think about in getting back to school. Ladies, I'll give it to you.
Excellent. Thank you so much, Jody. It's really a treat to be here with all of you. Just give me 1 second while I share my screen and get us started with our presentation. All right. So as Jody said, we are from Northwestern Health Sciences University. We've put together this presentation for you that's pretty broad. I mean, there's a lot to think about in terms of reopening, and so hopefully we'll cover a lot of things and then dive into the topics that you all want to talk about when we get to the Q&A section of the day. So a little background on our institution. Northwestern Health Sciences University has been a multidisciplinary institution since 1999. We currently have 10 programs. We have an acupuncture, just put this in alphabetical order. So acupuncture and Chinese medicine, chiropractic, massage therapy, medical assisting, medical laboratory science, medical laboratory technology, nutrition, undergraduate and PBPH studies, radiation therapy, radiological technology. So a range of different types of programs, and we have approximately 1,000 students, give or take, on the campus at any given time. So we are larger than many of your institutions, but our massage program is, small but mighty. So we feel like we have a lot of additional resources because we're part of that larger institution, but our massage program is not particularly large. We still have class sizes that are, between 10 and 15 people, typically, something like that. So I thought I'd start out by just sharing our current state of affairs. I know many of us are in similar circumstances, but as Jody pointed out, We're in varying stages of things depending upon the states that we're in, depending upon what's allowed for us at the moment. So in Minnesota, we are still in the stay at home. We finished our spring trimester online, as you all did, because our circumstances changed so drastically. So we should have ended a trimester mid-April. We did in fact end that trimester, but we had to put a number of courses on hold. The techniques courses were suspended. Didactic courses were completed online. Clinic internships were suspended. So some things were finished, some things are still hanging out there and need to be completed once we can get back face-to-face. We did start our new summer trimester at the beginning of, I'm sorry, that should be May. And we did take a new cohort of students. So that, I think that's another thing that people are making varying decisions about. But we started a new cohort in May, and we have four other cohorts that are continuing. We have a day program and an evening program, and they're in varying degrees of their programs. Right now, we're fully online. And so we'll take a little deeper dive here into what we are, how we're handling that summer trimester. I'm going to hand it over to Spring to talk about what we're doing right now in our massage program.
Okay, so hello everyone. Thank you for having me here today. So yeah, the stay-at-home order actually lifts tomorrow, and we're basically doing a tiered approach as to who is going to be allowed on campus. Right now, we're just looking at sort of acute care in the clinics and that sort of thing. But from the previous term, we had hands that we still needed to, or the hands-on portion of the courses that still needed to be complete. And so to be complete when we're able to get back onto campus, and we're sort of estimating around end of June, 1st of July. So that's our first priority, is get those hands-on courses completed and clinical rotations completed, but all around makeup, because we want to mitigate risk there. Yeah, we don't really have any state guidance yet for schools or the clinics reopening, where other than what I had just said. I kind of talked about the removal of techniques courses. With the May start, we had made a decision to basically take out all of the techniques courses and only do didactic courses. And so we made a decision to basically remove those and then bring in some of our fall term courses that were didactic into what we consider the summer term, basically. And so that students could sign up for those and at least get those completed, and hopefully with a plan in fall, which I'll talk a little bit more about in just a moment, to be able to have some kind of hands-on techniques courses for sure, or develop an approach to get them in, even if if we cannot be on campus for long periods of time. What if a stay-at-home order comes back into play? We need to think about those sort of things. Do you mind advancing to the next slide, please? Thank you. So we use learning management system. We use Moodle, and basically we have different tools that we have implemented. One of them I really, really love is Panopto, and Panopto is just a neat tool where basically it's a screen capture and a video capture. You can insert quizzes right into the presentation, so the students watching the presentation, all of a sudden the quiz pops up and they can't go forward until they actually complete this little quiz. It can be graded. It's just a really neat interactive way to do things. You can start discussions within it as well. Flipgrid is another one that's really cool if you haven't used it already. Of course, we are using quizzes and assessments online as well, and then providing feedback for those. And gamification is another thing that we have in our Moodle, where we can maybe do a crossword puzzle or something like that, which is really, really nice, which has been a lifesaver when it comes to keeping the engagement up, because that's something that we really wanted to do. At first, we were just scrambling to try to get our courses online, but now we wanted to level that up and create that engagement, because we didn't want to increase that feeling of isolation. And let's see here. Yeah, it's basically about, identifying what works best for the students. And that's why we chose some of these tools, to make sure that we can keep meaningful connections with our students. And it's been really nice to hear, because my students have said, you know what, I feel like I'm in the room with you, because you look in the camera and you talk to me and you're dynamic. And it's a lovely thing to hear from the students. And it gives me goosebumps just thinking about it, because we wanted to provide the best practices around remote learning for sure, so that they get the content. I'm teaching pathology, so that's a course that definitely you need to keep that engagement so they get those concepts for definitely. Holding meetings in Zoom and team as well, virtual meetups. And we didn't want to require any of those because some people have different things that they have to take into consideration. Maybe have kids running around. So I am actually providing 2 different meetings or virtual meetups, one in the day and one in the evening during the week. And it's basically just a 30-minute to 45-minute meetup to where we talk about deeper concepts. I can see their faces in real time and hear their voices. So it's been really fun. And then I record those and provide those for the students too, which has been really nice. Do you mind advancing, please, Michelle? Thank you. Yeah, so we're looking at various scenarios, and the senior leadership team has built teams around various scenarios on, okay, what if we can return in May? What if we can't even return to fall? What if we can't even return to winter? So all of these different types of levels of what is it going to look like, because we don't want to be reactive, we definitely want to be proactive. All right.
So I think the strength of that multiple scenario planning approach is that it helps all of us as faculty and administrators embrace the uncertainty of the time that we're in. Planning for all the different scenarios helps us create flexibility. It gives us an opportunity to get multiple people around the table and get our heads on imagining new ways of providing education. And so I think it's been a really successful strategy in helping us be more nimble. So I just wanted to share this with you in terms of how we've been planning ourselves around it. I think that strategy has been good. So maybe you've already been doing some of these same things, but if you haven't, consider looking at it from this multiple scenario approach. I think the greatest win out of that is it's helped us not be so focused on when things are going to return to normal, which I think all of us were initially focused on. Well, that's not happening anytime soon. This way, as things unfold in unpredictable ways, we will be much more prepared to respond and execute on some of the plans that we have in place. Likely it will not go exactly neatly into any one of those scenarios, but planning for multiple scenarios gives us lots of options, I would say. So here are the sources that have been informing our decisions. I'm sure some of the same ones you all have been looking at: Centers of Disease Control, of course, the World Health Organization. We're watching Johns Hopkins University, of course, our state, Minnesota Department of Health guidelines. And I imagine many of you have seen this recent resource that just came out, Preventing Disease Transmission in a Massage Practice, by Ann Williams and Eric Brown. So that's a really useful tool, I think, for massage. It addresses in practice, and it also addresses educators and what our schools might need to look like. So I think the challenging thing for us in terms of resources is that they are evolving every day, right? It's not like we have some resources or guidelines that are clear and unambiguous and not changing. We're learning every day about the pandemic and about how we best respond to it. So we have to continue referring to those guidelines and then evolving our protocols and procedures. So what I'm going to share with you in terms of our protocols and procedures are really what we have in place right now. I'm not going to go in tremendous depth about it. We're going to share the overview of what we have right now. We're happy to go greater in depth if any of you are really interested in that, but just to show you kind of what we're thinking about that right now. So I'll hand it back to Spring for these next couple.
Okay, so yeah, definitely considerations. Is there a feedback? Is there a terrible feedback? Because I just heard a terrible feedback.
I'm not hearing.
Okay, good. Thank you. I appreciate that. So definitely phased reopenings for sure. Like I was talking about, we are, our first priority is makeup from our previous hands-on requirement, and that's basically all we're allowing, with didactic classes continuing to be online for sure. And then when we get into the building, even for these makeup classes, I mean, there's things to consider. So we need to consider spacing, of course. We need to consider the room and how many we can actually hold in the room at one time. If we could, originally hold 10 students in a room, and we have 5 tables, then we're definitely going to bring that down to about 50%. That's sort of what we're using to maintain the distance requirements. Masks and gloves are going to be a requirement for us. So even as massage therapists, we are definitely going to be wearing gloves. And then, of course, training in all surfaces being cleaned as we're using them. And then, of course, a wipe down afterwards, after we're done with the classroom. I talked about that. I talked about hand hygiene, and then handling of new infections. That's one where we do, and ever since this has come out, it's that 14-day. You know, if you have been exposed, you need to self-isolate for 14 days, and that would be the same thing, whether it be a faculty or a student, where yes, I have tested positive for COVID-19, therefore we need to self-isolate, and all of that information, of course, not who has tested positive, but that goes out to say, we have been made aware that, you know, a student or a faculty member has been, you know, they have, I'm just getting a feedback, a little thing, so it's throwing me off a little bit, I apologize, but that basically, you know, as of this date, they're going to be self-quarantining for 14 days, that sort of thing. Do you mind advancing the slide, Michelle? Thank you. So temperatures at the door is something that we're going to do. Like I said, with the masks, we're staggering classes and clinical rotations to make sure that we are not overwhelming how many people are going to be in one place at one time. You know, with us, we have all those other 9 programs. We have acupuncture and chiropractic clinics and makeup classes that still need to happen from winter term as well. So we have to coordinate on who's going to be on campus and when. And then, of course, I talked about the limited class sizes, and we are talking about converting lecture rooms to lab rooms so that we can accommodate all of the makeup that needs to happen even just from the winter term, and that when patients do get there in a that they will call from the outside, and then of course answering the screening questions before they can even get in. They're taken at the door, patient temperatures are taken at the door and escorted in, as well as no waiting in the reception area. So the furniture is going to be removed, magazines removed, all of that. It's kind of like one person comes in, they get situated, and then another person comes in and gets situated. So very calculated that way. Do you mind advancing, please, Michelle? Thank you. And I talked about the sanitation, the hygiene. There will be PPE training when all the students get back in, definitely, and even for the staff too, just as a reminder, and the faculty for sure. And then additional devices for consideration, maybe UV lights and HEPA air filtration, but those are considerations that we'll sort of make as we move forward.
And I think on that topic of the UV lights and HEPA air filtrations, I think that those have not been clearly identified by CDC and the WHO as yet. So we're just waiting for clearer guidelines about how vital those pieces are, and then we will implement them as we see that information come out. So that's our status on those.
Yeah, and these are additional considerations that we need to think about is, what if the classroom is carpeted? What if your clinic floor is carpeted? You know, there's what do we need to do with that? And then do we need to put barriers between tables in the classroom, or is the spacing going to be enough? And then table warmers, that was one thing that came up. It's like, what about table warmers? We need to be really careful about those things. And we have decided just basically to remove them, because it's just easier to wipe down the vinyl and sanitize that. We just want to, again, mitigate risks. And then the lubricant handling, are we able to use a pump bottle? That's probably not a good idea. We need to probably use single containers as well. And we haven't necessarily hit that yet. This coming week is going to be a lot of the finalization for this, but that's going to be a suggestion for sure, that just kind of a single use type container with a lid on it that we use and then we throw away afterwards. And then, yeah, portable hand washing stations may possibly be something, or just limiting how the clinicians or how the students wash their hands, and clinicians how they wash their hands. And then, of course, disinfecting wipes and hand sanitizer dispensers at the door for sure.
Yeah, I think if we can begin to imagine how to make it easier to touch the doorknob less right after we touch our hands, or how we can disinfect our hands immediately when we walk in the door, those kinds of things. So those, we have some new considerations that weren't as vitally important before. For us, if we're going to transform some of our lecture classrooms into techniques classrooms that weren't designed that way, we may have to consider some of these strategies around portable hand washing. Those rooms are more likely to be carpeted. Our techniques rooms have regular floors, ceramic floors, but the lecture rooms are more likely to be carpeted. So I've heard some great ideas circulated around using like a plastic chair mat to make it a non-porous surface that's easily cleaned that we can put underneath the tables. There's been some really creative ideas like that. I'm sure you all have some things to share when we get to our Q&A time.
Mm-hmm.
All right, so oh, Spring, I'll let you keep talking about this because this gets to what we're going to do with our techniques courses.
Yeah, so we're all thinking about the next, we're in this term now, we have a plan, but as far as next term goes, which is our fall term, that is what we call it. We needed to provide an environment for our students. We don't want to keep putting off the techniques courses. They need to get started in those or continue on with their education in those. And so how do we do that safely? And what we've decided to do is basically do sort of a remote learning with campus intensives is what we're calling it. So throughout the term, there will be remote learning for everything didactic, of course, even within a techniques course, as well as some common or let's say draping, right? Body mechanics, effleurage, petrissage, stroke application. So our instructors are demoing that via video. And then there's a neat software application called Go React, G-O-R-E-A-C-T. Basically, it allows you to real-time comments to the student's video. So the student would be able to perform the techniques, show the instructor, and as the instructor is watching the video, exactly at the points where the instructor wants to make the comment, they can actually make that comment and use that as an assessment tool. So the intensives, when we're together in the intensives, those are used for, not anything didactic, maybe a quick review of the material that they have already covered, but then we're on the tables. We're doing demos and we are on the tables. We're thinking about, because for instance, we have a class called Relaxation Massage 1 and Relaxation Massage 2. So in these courses, normally they're offered 7 weeks for the first one, 7 weeks for the second one. But what we're doing is considering that if for some reason, let's say this gets out of whack again with COVID and we have another stay-at-home order and nobody can go to campus for the intensive. So now we need to figure out how to layer into the next class, Relaxation Massage 2. And so that's sort of what we're building, is we're building this layering effect that, let's say we have to stay home for a period of time and we can't get back until the second 7-week section. Well, then we need to be able to layer Relaxation Massage 1 information into Relaxation Massage 2 information. And depending on that could possibly be a lot of information, but throughout this whole time, we're doing things remote too. We're doing an entire posterior routine via video demonstration, and then the student is also doing that via video, and then we're providing real-time feedback, and those intensives are just really getting down to business and going through that, and the instructor's right there, that sort of thing, like we normally do techniques classes. I think I talked about all the rest of, I think I talked about that.
All right, so the last piece here is what we feel like students, we have to stay focused on what our students need from us during these turbulent times. So I think this idea that we're focused on the future, that we have strategies for a variety of ways that our future might unfold, and just as many ways as we can to keep their eye on the finish line. I know that many students across the country and in many different programs have been considering maybe they should just hit pause on their education. Maybe they should just take a trimester off until this all goes away. And it's increasingly clear to us that that's first of all, not going to happen, right? We need to plan for the long haul a little bit, but we can help them keep their eye focused on that finish line and wrap it up. The jobs will certainly be there for them on the other side. They're just going to really look different than they did when they started massage school, perhaps. I think that our students are comforted by the fact that we have a plan. And of course, we are all concerned about the future, and we're certainly a couple months ago very much scrambling to get things online. But the more we can demonstrate that we have a plan and that that plan has flexibility, not only within the curriculum and how we can roll the skills out for them and teach them in the best possible way under their circumstances, but that we understand and are flexible with them in their circumstances, right? As Spring said, some of them might have little kids at home. Some of them might be essential workers and have jobs that take them out of the house during hours that they didn't used to need to be gone. So we need to have some flexibility, both in terms of face-to-face. Maybe some of them can't come back to campus when the rest of us come back to campus because of their own health or the health of somebody in their home. So our flexibility is certainly something that they need as well. So those are all things we're trying to keep in mind to stay really student focused and centered in our process of planning. And that's what we have for you. Like I said, we really just intended to give a high-level view of what our planning process is and some of our considerations. I really appreciate your attention, and we would love to talk to you. So feel free to reach out to us if you have any more specific questions that you want to connect with us one-on-one. We'd love to do that. And that concludes the formal part of our presentation today. So we will stop our recording, and then everybody please